I'm Erin Paskey, owner and founder of the Nashville Dyslexia Center. Parents often don't know where to turn when their child is struggling with learning how to read. They may hear about testing for a learning disability, but they don't know what that means or where to go next. My guest today will help break it all down when it comes to dyslexia and testing. Dr. Sarah Richie, tell us a little bit about yourself and what you do.
Hello, everyone. I am a neuropsychologist, which means that I have a PhD in clinical psychology. I got that from Ole Miss years ago. And then I did a fellowship. I did 3 years of fellowship, initially with the adult population because I wanted to be able to do over the lifespan. But then my primary 2-year fellowship in neuropsychology was at Le Bonheur Children's Hospital and with the UT Neuroscience Institute, which was just a wealth of information, lots and lots of different presentations of anything that can go kind of wrong during the neurodevelopmental process. So I've been really fortunate, and I'm so glad that that was available to me. And then I started private practice. I've been in private practice for over 14 years now, which sounds shocking as I say it, but it's been wonderful. I've seen so many different kiddos and young adults, and primarily my practice now is assessing learning disabilities and neurodevelopmental disabilities. Dyslexia, dysgraphia, and ADHD are primary. So that's why, we're talking today, of course.
Tell us a little bit about dyslexia. What is it?
So I think the most simplistic way to describe dyslexia, there is a fundamental issue, problem. It's a learning disability in reading. And so it then kind of goes into spelling and written expression. And so the primary issues with reading typically are initially going to be with phonological processing. But the issue is the brain just doesn't hear things. The brain sees things. So you have this mechanism in your brain that's called orthographic mapping, and you get to visually send signals to the brain to say, hey, I recognize that word. I know that word. I don't have to even break it down. And the ultimate goal is to reach reading fluency so that you can then just focus on your comprehension. And so all of these magical things in the brain collide so that you can understand initially what these letters are, the visual representation, and then the sounds that are associated, and then putting them together. And then they make words. So if you've ever seen the Scarborough reading rope, so how that actually kind of comes to fruition in the brain, it's a very complex process. But the gist of it is a learning disability in reading that we really can't explain any other way. You've gotten the instruction, you've gotten the exposure. You don't have any issues with other types of things. You have these strengths and weaknesses patterns that we can't explain any other way. And so that kind of is the gist. And they're currently redefining dyslexia from a definition standpoint. I think the UK, about a week ago, they put out kind of this really informational, bulleted, pointed, this is what it looks like. These are the other comorbidities. So it's not just dyslexia. We have to look for dysgraphia. We have to look for ADHD, all these other things that are running on the same subsystems in the brain.
So, when should a parent have a child assessed or evaluated? I've heard either term, evaluation or assessment. So, when should they come to a neuropsychologist like you?
I think for what I do, I start at age 6, but it really depends on the specific presentation. And so in my world, I truly see each child as his or her own best baseline. So where are they coming to me in the level of skill that I can assess for all of the areas of the brain that we're all interested in? So it's not just an IQ measure. It's not just the academic achievement piece. It's memory, it's executive function, it's visual perceptual skills. And the great thing is when you start at that age, you've already been exposed to words for years and years and years. So typically the patients that come to me, we've tried this, we've done this, we just haven't seen as much impact. So the gap is still there. Why is the gap there? So usually I start at 6, but for definition and for diagnostics, I trust the latter part of kindergarten into first grade, because you really have no other explanation because you've been exposed and had the intervention probably already. I've seen people that have had speech language therapy already, occupational therapy already, dyslexia tutoring with a multisensory or Gillingham-based trained specialist. What's going on?
Tell us a little bit about what a neuropsychological evaluation is like. What can parents expect when they work with a neuropsychologist like you?
So basically, I say I play brain games. So for the young kids, I think that's more meaningful than saying we're going to get tested for X, Y, and Z. If you talk about it from we're going to do some blocks and some puzzles, we will do a little bit of schoolwork because you're a kid in school, that's your job. So early on, you just want to make them feel as comfortable as possible. Then for the young ones that are too young to fill out forms on their own, psychosocial evaluation, they stay in a different room and I give them all the things they need to stay occupied while we go over everything, just adults only, without listening ears present. So we want to be able to say everything that we want to say before we start our brain games. And then throughout that, parents will stay in the waiting room while we play our brain games. And during breaks, we get to see everybody. And then after we get, it's typically about 3 hours of testing, sometimes more, just depending on, if someone needs a little bit more time for this or needs a few more brain breaks. And then after that, we do exactly what we did at the beginning. So the kiddo goes back in the little bitty waiting room with all the blocks and the puzzles and the colors and all the things, while the adults, we kind of just hash it out. These are the things that I see. The qualitative review is so important to me, not just the score that comes out of an evaluation, because you need to know why this has led to this score. And so the qualitative error review for a child who is being assessed for dyslexia, I want to see, are there transpositions in letter sequence, like was for saw, who for how? Are there still letter reversals? And there's two, at an age where you wouldn't expect that, the visual orientation. Are there just phonological processing and blending, decoding and blending issues? I want to see all of this and show them the errors that I'm seeing and why.
How often does a child need to be tested or evaluated?
It really depends on the child. So I have certain patients who also have neurological disorders, like a seizure disorder, or they've had a traumatic brain injury. A lot of those evaluations are yearly, just to track the progress, because if there's an active seizure disorder, you kind of want to monitor those changes as a result of the electrical dysfunction. For typical, if you just need it to be current, it's every 3 years, because I trust the specialists that are actively working with those children, especially the teachers and the boots on the ground folks, to say, this is where we see this child and these are the areas that we still need to identify in terms of intervention. And then I'm kind of the person that comes back in through the comprehensive evaluation of all the brain skills and say, oh, this has worked beautifully here, or these are the areas that are still areas of weakness that we can continue working on.
So let's go back to that initial evaluation. The child has gone through the whole process and a diagnosis of dyslexia comes back. What should a parent do with that diagnosis?
Multiple ways that it kind of the train track and trajectory is different for every patient, in my opinion. Some parents come and they don't know exactly what's going on, so they really do want that diagnostic quality of the evaluation. And so, of course, I'm a diagnostician. I diagnose. I'm licensed by the state of Tennessee to do these diagnostic evaluations. Some parents come because they kind of already know that that's the thing. So now what's been contributing to this? If there's something that we've missed, so they get the diagnosis of dyslexia, but also we see that there's some subtype of ADHD. So that particular report doesn't just go to the school, it also typically goes to the physician, but also we have a better understanding of their other contributors here at play. So if someone has in a private school, they will typically take it to whomever the learning specialist is, and they create a personalized education plan. For a public school, it's a little bit different because in Tennessee, there's that response to intervention. And, RTI is not supposed to be this barrier to getting an evaluation. And the federal government came down really hard on that several years ago. But if that's the process that the school requires, at that point, the parents use it as, we know this is going on. What can we get at school for accommodations and supports? And then what we're unable to get at school, if there is a criterion that they haven't met, a percentile they haven't met, then we know that we need to do private services to really bridge the gap.
Let's talk just briefly here about your evaluation versus what a public school evaluation does. Can you explain the difference?
I think that, for public school, I think that when you have those kind of administrative laws that are defining what dyslexia is, or in the state of Tennessee, kind of those tendencies that are able to be identified, and then dyslexia specific intervention, it just is, and I see people from Mississippi, I see people from Arkansas, I see people from different states, so it just really is variable. But a school evaluation is one to say, do you qualify for those school services based on the criterion that are available through our state to define who gets an IEP or what a 504 plan would look like for you. In my world, I'm comprehensively assessing everything the brain is doing. And so I'm not just focused on, do you meet criterion for supports in this realm? And a lot of times that can collide because we both have the same goals of identifying what's going on. But for me as a diagnostician in the kind of clinical practice world, I am looking for what are we meeting criteria for based on the diagnoses, but also what do we need to do beyond just the individual tutoring or beyond just this, other service that would be effective too. So mine, I think, I'm not dictated to by what my battery looks like. And so I have to assess not only the psychoeducational piece, which is the IQ and the achievement, but I go through and test memory, visual perceptual skills, visual spatial skills. Executive function is huge. So we know that executive function is kind of a fancy way to say all the things that kind of go into an ADHD diagnosis, but also impact everything else from an independent standpoint. These things that have absolutely nothing to do with your ability, but everything to do with your independence in executing that knowledge or taking in new information. And so those are the domains of neurocognitive processing that I think are extremely important because those are the actual skills that allow you to learn in school and allow you to develop these academic skills. But you also have to look at psychosocial functioning. What does this resilience look like in this child? Have we lost resilience? Is there a performance-based anxiety that is a dark cloud over their performance and you knew they knew it last night, but when they get to the test, it's like they never saw it. So those are the comprehensive areas that I think just define a proper comprehensive evaluation from a neuropsychological perspective.
So if I might say it this way, a public school will do an evaluation to see who qualifies for special education. Yeah. Whose needs are the greatest in order to get that IEP, whereas you're setting all that aside and you're looking at the whole child, their strengths and their weaknesses, and you can give an actual diagnosis of several different conditions, whereas a public school cannot give a diagnosis. They might use terms like specific learning disability, but that is actually not a diagnosis. And I think that's very confusing for parents. So it's good to flesh that out and see the difference in the evaluations.
Right. And sometimes I do include a diagnosis of specific learning disability with impairment in reading and the sub-skills that are included in whatever is going on. The qualitative review, is it reading comprehension? Is it single word reading that includes phonological processing? Because that's coming from a different diagnostic manual than we kind of understand from just the whole gist of what dyslexia is. But they're running on the same subsystems in the brain. It's just a different way for the label to be on there. But in my opinion, again, sometimes the diagnosis is very important to whatever, the trajectory of this child's, academic course is going to be. But sometimes it's more of what else is going on? What are these subsystems that are involved? How do I help with all of these as well? So yes, diagnostics, but more of a comprehensive review of everything that's going on rather than do I qualify for something?
I see. Is there anything else that you'd like to share with parents when they're considering an evaluation for their child?
Just think to yourself, what is this going to entail? What areas are going to be assessed? What are things that are important for me to know going in? And in my opinion, like you go to a licensed psychologist in the state of Tennessee. I think that, this test of dyslexia has come out, and I think that it's probably a wonderful way to look at these specific parts of reading. There's just so much more the brain does. So that in and of itself is not an evaluation. That is kind of a marker of things that are important to know. But when you look at comprehensive evaluation, you ask the question, who's going to be doing the evaluation? Are you going to be doing the evaluation, or do you have technicians? When do I see the doctoral level person again? And in my opinion, what I do, I just want to do everything from start to finish. I want the behavioral observations during that 3 to 3.5 hour period. I want to know if I'm seeing what you're seeing at home. I want the teacher evaluation to say, is this what you see at school as well? It's more of, in all the areas that you're expecting this child to perform within, what does it look like? And I just want, to do all of that myself. So there are different questions that you ask initially, but then after everything is said and done, you have a test results session. And so that's when we go over everything that, yes, we have one of those right after testing in a sense, but when you've gotten the full report that may be 28 to 30 pages, we go over those and hit the high points and say, some of these things are not applicable. Some of this is written for the physician or written for the audiologist or written for the dyslexia therapist. Some of this is really important for you to know. And that's when we go over and just usually, for me, it's a Zoom call, or you can come in if you need to, but it's easier to do it in Zoom call for everybody's schedules these days.
How can parents find you, Dr. Richie?
I have a practice in Maryland Farms in Brentwood, Tennessee, that my website is sarahrichiephd.com. And I was in Memphis forever and ever, and now I'm here. So it's just a Google away, I think.
Well, thank you so much. You've been so helpful in helping parents understand what is a neuropsychological evaluation and how to help their children the best. Thank you so much.
Thanks for having me.